Good afternoon. I'm Dr. Sandra Martell, the Public Health Administrator for Winnebago County, and today I'm joined by Mayor Tom McNamara. I have a theme for today, and the theme for today is numbers count. So the first kind of where we're going to talk about numbers is back to school. Schools have started opening in Winnebago County, including Keith, South Beloit System, Rockford Lutheran, and Rockford Christian. All of our schools, though, have been getting ready to start and have been working hard to offer options of remote or in person. But regardless of whether you're a family that has chosen remote or in person, I'm going to remind you some other numbers. You need to get your routine vaccinations for all children. And children should receive their vaccinations through their medical home. But in recognizing that it's been hard to get to our medical homes, some of our primary care providers have restricted hours, or maybe it's been harder to come in if you're an essential worker. Health and Human Services has issued emergency rules allowing pharmacists to administer vaccine to ages 3 and above using American Committee on Immunization Practices schedule. Routine childhood physical exams should be done on all children. Make sure that you start a routine to get them ready for those early start times. Whether they're remote or in person, they need to be clocking in at school. Have them start going to bed earlier by the numbers and getting up earlier. And I know this is a challenge with high schoolers, but we've got to start so that our children are ready by the numbers. If you've chosen the in-person option for your child, please help your child to learn to wear masks so that they're ready to start for the school year. Make sure that you're using a child-sized mask. Let them pick out their mask. Do not use lanyards or any kind of ties around the necks of small children, as this could be a strangulation hazard. Let them put it on their stuffed animals and dolls. You can always wash them later, but the idea is to get them used to wearing a mask. Wear them in your home as a family, starting for shorter periods of time. 1 hour and gradually increasing to 5 hours, because that's the length of time they're going to be spending in school. And provide positive reinforcement for children. You can do stars on a checklist, letting them pick out a storybook in the evening. But again, by the numbers, help them increase the number of hours that they're spending wearing a mask. And model good behavior on masking. As we all know, our children learn more from watching us than they do from listening to us. And yes, to the children in the audience, you still need to brush your teeth, and you're not allowed to chew gum under those masks, according to the teachers. They can see through those masks. Help your child get ready for remote learning. It's just as important. Remember to set up a school space in your home for remote learning. I know that this is challenging in some places, but put aside a place where the child can get themselves logged in and ready to start their school day. Make sure to have your numbers of school supplies ready. They still need things like crayons and papers that support them in their remote learning, because we want this to be a good year by the numbers. Winnebago County Health Department continues to update and post travel guidance on Tuesdays. And again, we're looking at the numbers related to infection rates higher than Illinois. And we continue to encourage. I know that there's been some discussion that the Centers for Disease Control has lifted any kind of travel restrictions or a need to quarantine. But as we look at our numbers, we want to continue to keep our numbers low. So if you're planning to travel to areas in which the numbers are higher, be deliberate and intentional. And understand that you might be required or asked to quarantine by your employer, or best practice so that you can return and keep our numbers low in this area. The other thing we're going to talk about, again, numbers about seasonal influenza. You're going to start seeing that it's time to start getting vaccinated against regular seasonal influenza. Who thought we'd ever call it regular seasonal influenza, right? And again, flu vaccination is recommended for anyone 6 months of age and older. Pharmacies, again, will be able to vaccinate children 3 years and above. And remember that even though these vaccines, oftentimes I've heard this story, oh, they don't protect, it's not 100%, it reduces the severity of illness in those who contract influenza. And I remind the public again that we don't want to have to fight off both seasonal influenza and COVID co-infection. Anticipating vaccine, again, at the end of our calendar year, for the optimist in me, is that we are going to be seeing some of those vaccine trials and some vaccine coming out at the end of this calendar year, beginning of next. We would not want you to delay or postpone your COVID-19 vaccine to get your seasonal flu. So once your doctor's offices have it, when you see the pharmacies have it, get vaccinated against seasonal flu. And for those children who are returning to remote or to in-person learning, it becomes doubly important because, again, we want to protect them against transmission of flu in the classroom environment. Another number to think about is the number of those of us who do not vote on a regular basis. The pandemic is not over. If you're in a vulnerable population, request a mail-in ballot. Your vote counts, and those numbers matter. Another number that we're worried about is our census numbers. Completion. Communities of concern. Listen up here. You've been impacted by higher rates of COVID-19 and other negative social determinants of health, including housing, poverty, educational attainment, and employment. And you've also contributed to lower census completion rates. Do your part. I'm going to give some zip codes out here and some census tracts and tell you what the completion rates are. Zip code 61101, 61102, 61103, and 61104. The numbers are on the table for you. I'm challenging you to get your numbers up. Anywhere in those census tracts from 10, 11, 12, 13, 18, 25, 26, 27, completion rates are running at less than 50%. That means we're counting at less than 50%. And these same communities have twice the infection rate. So don't count yourself and undersell you and your community by twice. Please complete the census. And the deadline for the completion is September 30th. We're close and closing in on that date as well. Your household counts. Another positive number to report are we added 11 new members to the team for case investigation and contact tracing who started with the Winnebago County Health Department on Monday, August 17th. Hiring continues with the goal of bringing all 51 on board by September 30th. We ask for ongoing cooperation of the community to answer their calls and provide the necessary information to help prevent the spread of COVID-19. It is through your participation, cooperation, and effort that we've been able to identify cases, contacts, and been able to keep our infections low. And with that, I'm going to give you the numbers for today, our last and kind of final discussion on numbers. Today we're reporting 17 new cases, which brings our total count to 4,087. Our positivity rate is going up very slightly, but 3.9%. Our recovery rate is at 96%. But once again, we have one additional death to report, and our community mourns the loss of one member. No matter how small the number, we continue to mourn those losses. Our total deaths remain at 148. We have no new locations of concern, and one location of concern will be coming off. We anticipate that Winnebago County will be turning orange for critical for new cases per 100,000 for the week ending August 22nd. And we look around our region, we look around our state. Today you heard that Regions 4 and Region 7 are having to implement additional interventions based on the tiered strategies, including the reducing hours, reducing capacity, and closures in bars and restaurants to internal services. But we have to do our part in Region 1 to keep our numbers low. We have to be vigilant. We have worked way too hard. I don't want to give up in the last quarter mile of this marathon. I don't want to have to give up the opportunity for in-person learning and education in our community. So we must continue to wear our face coverings and masks when out in public. You heard the new requirement that when you're at a bar or restaurant, when you're in contact with someone who is not a member of your household, they come to serve you, or you go up through the drive-up window, you should be wearing your face covering. Maintaining physical or social distancing of at least 6 feet. We need to wash our hands and clean and sanitize frequently touch surfaces. If we do these things, we can keep our numbers low.